النهارده احنا هناخد examination of a swelling, local examination of a swelling. أول حاجة في local examination of the swelling is inspection زي ما احنا عارفين. inspection ده هنقف facing the lesion اللي احنا we are going to inspect it and we are going to describe it as you know according to what we are going to see. Is it one swelling or two swellings or multiple swellings? Here we can see that there are several swellings, not only one swelling. 1, 2, and 3 swellings. We can compare the both sides and make sure that this is the bulge that we are going to see is not present at the other side. يبقى احنا we are going to describe A. There are 3 swellings. مكانهم فين بقى the 3 swellings دول؟ The 3 swellings are at the back of the right shoulder and the nape. يبقى at the right side of the nape and the right shoulder, upper part of the back. طيب. How are we going to describe the shapes of the swelling? These are not one swelling. We are going to describe each of these. Each of these swellings هنقول the biggest swelling is the lowest one, which is just behind the tip of the shoulder, as you can see, and it is oblong in shape. When we say oblong in shape, then we are going to describe 2 dimensions. The longest dimension here, we can compare it to our finger, or we can use a ruler. So if we compare it to our finger here, I know my finger till here is 7.5 centimeter, and here is about 2.5 centimeters. So in the longest dimension, it is about 10 centimeter by 8 centimeter. Then I'm going to describe similarly the swelling above and similarly the swelling above. If we continue with description of this swelling, then we are going to describe now the overlying skin. The overlying skin here looks normal. There is no induration, there is no edema of the overlying skin, there is no pigmentation, no sinus openings. So I'm going to say that the swelling is covered by normal skin. What about the area surrounding the swelling? The area surrounding the swelling is called the margin. So I'm going to describe now that around the swelling here I can see no other nodules, I can see no other lesions. So the area around the swelling looks normal, so the margin looks normal. Is there a special character of this swelling? We can see no pulsation of the swelling. This is not a swelling at a hernial site to ask the patient to cough, for example, but there is no spontaneously any pulsations at this part. So this is going to be the inspection. Now, this swelling overlies muscle area. So, to see how does it appear more with muscular contraction or less with muscular contraction, we ask the patient to contract these muscles. You know how to make each of the muscles to be activated and to contract. Now we are going to ask the patient to push back his elbows. ممكن بعد إذنك تزق بكوعك إيديا لورا. So as you can see, ريح زق. We can see that it becomes more prominent when the patient contracts his muscles. This means that the swelling is superficial to these muscles. Now we are going to proceed to palpation. And the first thing that we are going to proceed with is to test if this swelling is tender or is it hot. Hot, you can do it with the back of your fingers. You can do it with the flat of your fingers. And you compare both sides at the same level. So I'm comparing here. And at the same time, I should be looking at the face of the patient to see if there is a grimace or something that will indicate that the patient is in pain. Alternatively, I can ask the patient before I examine him by palpation if it is painful to him or not, if it is tender when it is touched or not. And I should assure him that I'm not going to inflict too much pain during my examination and be gentle with the patient. Now here, the swelling is not hot and not tender. Then I proceed with confirmation of the inspection and at the same time eliciting new signs now. First thing, I'm going to see the consistency of this swelling. The consistency of this swelling, if it is solid or cystic, and if it is soft, firm, or hard. Now I can see that this swelling is rather soft to firm swelling. In this case, I will proceed if I'm not sure that it is a solid swelling because it is so soft, then I will do a fluctuation test. We are going to postpone this fluctuation test to the end. Now, the swelling here is soft. I move my hand over the whole of the swelling, always palpating with the flat of my fingers all around here. So it is a homogeneous swelling, not a heterogeneous swelling. Some heterogeneous swellings may be firm, partly cystic, partly hard in this respect. Then I am going to feel the surface of the swelling here as I am palpating for the consistency, and I can see here that the surface of the swelling is smooth. It could be nodular, it could be lobulated. Then I'm going to test now for the edge of the swelling. I'm going to feel the edge of the swelling all around. Can I demarcate the edge of the swelling all around, or I cannot feel it all around? Here I can feel it all around. If I can feel it all around, it is called well-defined. If part of it is not felt, then it is called ill-defined swelling. Now, I am going to proceed with the mobility of this swelling and the mobility of the skin over the swelling. So if this skin can be pinched like that, or I can glide the skin over the swelling, I can glide it over the swelling, then it is not attached to the skin. If I glide it over the swelling like that and a dimple appears and the swelling is pulled with me during gliding it, or when I am pinching it, it is drawn with me up, then in this case it is attached to the skin. Here I can glide it, as you can see, glide the skin over it. Then we come to the edge of the swelling, and a special character when you find a swelling showing the characteristics, for example, of a lipoma. These are called special signs. Special signs like the edge of the swelling. If I press my finger at the edge of the swelling might move to the other side. If it moves to the other side, it is slippery edge. Sometimes if the lipoma is subfascial and not subcutaneous, like in this case, then we are not going to find this sign positive. Here, the edge is not slippery, although the swelling is having, although the patient is having multiple lipomata of his back. Why? Because these lipomata are subfascial, below the fascia. So it is difficult to let the edge glide away from your fingers because the fascia here is very tough fascia. But we have the other criteria that tells me this is lipoma. If I'm going to do the fluctuation test, you know that the fluctuation test must be done with 6 fingers. 6 fingers, why? Because I'm going to fix the swelling with 4 fingers and then put 1 finger midway between the center of the swelling and the edge of the swelling here, the other opposite to it at the same distance, and then I'm going to press with one hand. Press with one hand here, with 1 finger here, And this finger will feel if it is pushed to the up or not. This finger will feel. And then I'm going to repeat it here in a perpendicular dimension and feel it. If both are fluctuant, then I'm having an impulse at the receiving finger in both directions, then it is a fluctuant. If not, then it is non-fluctuant. Now in the lipoma, sometimes I can feel fluctuation, although it is not cystic. And this is actually, you feel it as a fluctuation. But it is said to be a pseudo-fluctuation. Pseudo-fluctuation means although it is solid, it is fluctuant. It doesn't mean it is not fluctuant. It is fluctuant, but we describe it as pseudo-fluctuation when especially for lipomata. So the lipomata sometimes have very special characters here, the slippery edge and the pseudo-fluctuation, which are peculiar to this type of swelling. Now, we are going to see how to elicit the fluctuation test in smaller swellings. And here we have a swelling bigger than 5 centimeters. We have seen how to do the classic fluctuation test. In smaller swellings, we can do that with 3 fingers. 3 fingers to fix the swelling here with the index, with the middle finger and the thumb, and my index at the mid of the swelling here is going to press down. If I can feel that those 2 fingers are parting like that when I press here, then it is a positive fluctuation. Actually, not yet a positive fluctuation. I have to repeat it like that. I have to repeat it like that to have a positive fluctuation in 2 dimensions. So these are for smaller swellings than 5 centimeters. What about if the swelling is too small, 2 centimeters or less, will not accommodate 3 fingers? Then in this case, like this swelling, I will compare the periphery here at the edge of the swelling and the center of the swelling and see which is yielding more. In solid swellings, the center of the swelling is not yielding as much as in cystic swellings compared to its periphery. The periphery will be here softer and the center will be little harder in case of solid swellings. In cystic swellings, we find that the center here is yielding. It is much softer than the periphery of the swelling. Now, we have said one special character, maybe the slippery edge, but there are special characters that we have to comment on also. These by palpation, by putting my hand here lightly. Of course, in this part, it will not be that. But if the swelling is at a site where a vascular swelling could be at a site, anatomical site of a big artery, there could be an aneurysm, for example. So in this case, if a swelling here, I just put, or an arteriovenous fistula, so in this case, you put your hand and feel a thrill, or you put your hand and feel a pulsation. But here I can actually press, especially if the surface has been heterogeneous with areas cystic and areas soft. Why? Because sometimes such a swelling is compressible. Compressible means if I press like that, it is going to decrease in size under my hand. And when I remove my hand, it is going to retain its normal size and refill once more. What could refill such a swelling? Blood, of course. So it is going to have a vascular element. Some lipomata are having vascular elements, and these are called nevulipoma or hemangiolipoma. In this case, the swelling will be partially compressible. Only the parts which are containing the blood will be compressible, and when I remove my hand, it is going to retain its normal shape that we have seen by inspection and felt by palpation. After that, we have to see the mobility of the swelling. The mobility of the swelling by moving the swelling in all directions over the respective muscle. I can see here that the swelling moves in up and down more than side to side a little bit. So probably this goes with the fibers of the muscles. Is it attached to the muscles or not? We are going to test if this mobility is going to be changed by contracting the muscles or is going to be retained as such. If it is retained as such with no change of the mobility that I tested while the muscle was relaxed, then it is not attached to the muscle. تقدر بعد إذنك تدوس بإيدك لورا ضد إيدي. أيوة. Now the mobility actually decreased. ريح. Mobility decreased. So this confirms that this lipoma is a subfascial lipoma and actually could be part of it submuscular or at least attached to the underlying muscle. And this test is done like that over muscles and also over tendons. If you have a swelling over a tendon, then you are going to test if this swelling is movable across the tendon or along the tendon while the respective muscle is relaxed, and then the patient will do a maneuver to contract this muscle and retest the mobility while this tendon is on the stretch. So to sum it up, now I am going to do the inspection and palpation. There are 3 swellings at the back of the right shoulder. The 3 swellings are different in size. The biggest is the lowest one, and at the higher one is smaller, and the smallest swelling is reaching the nape. The lowest swelling of them is oblong in shape, is about 10 by 8 centimeter. The skin overlying is normal. The surface looks smooth. I can see here the edge of the swelling all around. I'm going to confirm if it is well defined or ill defined by palpation. The margin of the swelling is normal and it doesn't show any signs, special signs. It is not pulsatile. It is not showing any other signs of special character in this respect. I'm going now to confirm this by palpation. By palpation, the swelling is not hot, it is not tender, the surface is smooth, it is soft to firm in consistency. I can feel the edge of the swelling all around, so the swelling is a well-defined swelling. The skin overlying, I can pinch it and I can glide it over it, so it is not attached to the overlying skin. Actually, I can move the swelling a little bit across, but up and down it moves better. زق ايدي لورا. The mobility becomes restricted in all directions when the patient contracts his muscles. There is no overlying thrill. It is not compressible. Of course, I will not ask the patient to cough because it is going to be ridiculous to do such a maneuver or such a command. And this is how you are going to do this. If you can feel a thrill over a swelling in some other part of the body, then you will have to auscultate for this swelling. Here, we are not going to auscultate, we are not going to percuss this swelling. Then you will have to describe the other 2 swellings that appear above this swelling just the same